This is One on One.
Brought to you by Holy Name Medical Center in Teaneck, New Jersey.
We are now joined by Dr. Adam Jarrett, Executive Vice President for Medical Affairs, Chief Medical Officer at Holy Name Medical Center. Can we talk Zika virus?
Absolutely.
You know the subject well. By the way, named after this is Zika forest?
In Uganda.
In Uganda. First case, 1952?
I think that's correct.
See, I just, I know that, but that's all I know.
Right.
The question is, what is it, and do you believe people are overreacting?
It's concerning. I do think people can overreact if they're not being careful.
What is it?
So it's a flavivirus. It's a virus, the same virus that causes dengue fever, or a similar virus that causes dengue fever, yellow fever, and chikungunya. It's been around since the 1950s. It's been endemic in some of the countries, particularly in Africa and the Pacific Islands, but more recently it's become epidemic in Mexico, areas in South America, Central America, and the Caribbean. The virus in of itself is a self-limited virus, so if you get infected with the virus, you'll have low-grade fever, aches and pains, headache, conjunctivitis, red eyes, and it's self-limited. It typically goes away in 1 to 2 weeks. The likelihood of significant complications for an individual is very low. It only needs to be treated with symptomatic measures such as Tylenol. The concern is the impact on pregnant women.
Let's talk about that.
Okay.
As we do this program, and we're taping in June, we'll date ourselves, but it's still important information. Savannah Guthrie over at the Today Show and other women who are very prominent. Savannah Guthrie decided that she would not be going to Brazil. And listen, we don't know what's going to be happening with the Olympics, but she decided she would not go over there. She's pregnant as we speak. Do you understand that decision?
Well, it is the CDC guideline and recommendation, and I think it's actually a smart decision. We just don't know the likelihood of a Zika infection causing a congenital malformation. It might be low, it might be high. We don't have enough information for the baby.
And that is called what?
The congenital malformation is called microcephaly, which is a small head and a small brain, and it's a very significant congenital malformation. These kids are not going to be normal, healthy kids. They're going to have significant congenital problems and maybe even die at a very young age, depending on the severity of the malformation.
Although we have so many women who are terrific women who run this company, our production company, our producers, some of whom recently had children, some are planning to have children, who are asking the question, what are the odds that a pregnant woman, what are the odds that she could be exposed?
So
and then if she is, I mean...
If you don't travel to an area where the disease is endemic or epidemic, the odds are almost zero. The likelihood of getting...
So you're in New Jersey, New York, Connecticut, Pennsylvania...
There's not been a single case in the United States of Zika that is not tied back to someone who traveled to one of the epidemic areas. So if you're in this country, the likelihood of getting a Zika infection is extremely low. If you are traveling outside the country to those epidemic areas, there is concern. And I think the CDC has appropriately recommended, especially until we have more information, that pregnant women and women who are considering getting pregnant don't travel to those areas until we understand this better.
Doctor, if someone goes on the CDC website, put it up, Jen Eichland, our producer. Put it up. What would they find?
The CDC website is actually very, very good. There's some basic information about Zika, some of the things we've talked about. There's information about how to prevent Zika. That's very important. If you're going to travel, it's important to use the preventative measures. Insect repellents, DEET is probably the best one. Appropriate clothing.
What's it?
DEET, D-E-E-T.
Go ahead.
Other types of insect repellent. DEET is the common, the active chemical in most of the over-the-counter insect repellents that you can buy. Using protective clothing, using netting at night if you're in an area where you may be exposed to the virus. That information is on the CDC website. Also on the CDC website is countries where Zika is epidemic. So you can easily go to the website and see if the area where you're traveling is concerning.
Is that evolving?
It is evolving. I looked at it this morning in preparation for today, and I think it's up to over 40 countries.
40 countries.
That have been impacted.
So in preparation for the show, I also came across the information that, I don't know why I didn't realize this, but there is no vaccine.
That is correct. They are working on the vaccine. Some of the things that Holy Name is doing potentially could help with that someday, although we're in the very early stages. I think, as you're aware, we have a sister hospital in Malo, Haiti.
Yes.
Haiti, an area where Zika is epidemic, which is a concern for the people of Haiti, and our hospital is helping those people to try to do what needs to be done to help them understand the disease and try to prevent infections and prevent the microcephaly. We actually have a relationship with a lab in Galveston, Texas, that's an affiliated CDC lab, and every patient who comes into our hospital who has fever is going to have blood work that's shipped up to that Galveston lab so we can run tests on it for Zika and run tests for other flaviviruses, dengue, chikungunya, et cetera. And we can try to tie that back to how the patients in Haiti do and to try to answer some of your questions about if you have the virus, what's the likelihood that a pregnancy will relate to microcephaly?
Before I let you out here, Doctor, I just want to be clear on something. Can the Zika virus be transmitted sexually?
It can. It was recently discovered that Zika is present in male semen, and it actually is present in male semen for longer periods than it's present in the blood. Again, we don't know how long today, but if you're going to be sexually active and you're concerned that your partner has Zika, you need to be aware of that and be very careful.
Wow. Important information.
Yes. Some other things that Holy Name is doing
Real quick.
to get that information out. We have a relationship with the city of West New York in Hudson County, something called Familia y Salud. We are partnered with the health department in West New York, and we are doing events with them to help improve the population's health in West New York. The first event includes an event in June, later in June, to educate the people in West New York about what they need to do with Zika. It's particularly important in West New York. It's a largely Hispanic population, and we're doing that in partnership with the U.S. Department of Health and Human Services and Department of Health in West New York.
Dr. Adam Jarrett, Executive Vice President for Medical Affairs and Chief Medical Officer at Holy Name Medical Center. Dr. Jarrett, thank you so much.
Thank you.
Brought to you by Holy Name Medical Center in Teaneck, New Jersey. MagnaCare, the New Jersey State Nurses Association, and the Institute for Nurses. And by ShopRite Supermarkets.